Welcome to Dementia-Capable North Carolina's Reducing Your Risk of Dementia. Without a crystal ball, it is impossible to know whether any of us will eventually develop dementia. What is likely for all of us, however, are the typical changes the brain undergoes as we grow older. Age-related brain changes include changes to our memory, attention, executive function, and processing speed. We can't stop the aging process. However, there are many things we can do that may prevent or delay the onset of dementia. Risk factors are elements that increase the likelihood of developing different types of dementia, such as Alzheimer's disease or vascular dementia. Modifiable risk factors are those aspects of our life which we may be able to influence. Understanding these risk factors and the changes we can make are crucial in helping to decrease our risk of developing dementia. And remember, having one or more risk factors does not necessarily mean you are going to develop dementia. The 12 known modifiable risk factors that research has identified are less education, social isolation, hearing loss, depression, traumatic brain injury, obesity, physical inactivity, high blood pressure, diabetes, excessive alcohol use, smoking, and air pollution. Let's look at these risk factors more closely to highlight ways you can decrease your risk. Research suggests that fewer years of formal education might increase your risk of dementia. This underscores the critical role that access to quality education plays in our development. Early learning lays the groundwork for strong cognitive skills throughout life. As you age, lifelong learning and mental stimulation can strengthen your brain health and build your cognitive reserve. You can support your brain health at any age. For instance, you can learn something new. Take a class at a local community college. Explore a creative hobby like painting or woodworking, or check out the latest bestseller at the library. Challenge your brain. Engage in classic brain teasers like chess, Sudoku, or crossword puzzles. Expand your horizons. Volunteer at a local organization. Visit a new place, or join a club in your community. There are endless ways to keep your mind active. On the other hand, if you do not stimulate your brain, for example, due to social isolation, your brain health can suffer. Social isolation can raise a person's risk of developing dementia by as much as 60%. Unlike loneliness, social isolation refers to how often an individual sees family and friends or participates in social or community activities. Increasing social connectedness stimulates your brain, helping to build cognitive reserve and aiding in resisting the effects of dementia. There are many ways to do this, and many of these strategies can also positively impact other risk factors like physical activity and depression. Consider volunteering, engaging in a regular group activity, or pursuing adult learning. Maintaining contact with family and friends is beneficial, as having conversations exercises various mental skills and helps build your cognitive reserve. Even surrounded by family and friends, some people experience isolation. One condition that can contribute to this is hearing loss. When you cannot hear well, your brain must work harder to process sounds and fill in the gaps, leaving less energy for other important cognitive functions. If you feel you may be experiencing hearing loss, it is worthwhile to get a hearing test to obtain a diagnosis and explore treatment options. And, if needed, consider hearing aids, as they will significantly improve your ability to hear and engage in social interactions. Utilize assistive listening devices, ALDs, which are handheld amplifiers with microphones, to enhance one-on-one conversations by capturing desired sound and filtering background noise. You can also aim to reduce noise exposure, maintain a healthy diet, and manage your stress. The Audiology Project provides an online tool where you can access a free hearing test. www.theaudiologyproject.com/HearScreenUSA. Another condition associated with social isolation is depression. Depression is a mental health condition characterized by persistent low mood, fatigue, and a lack of interest in activities that one usually enjoys. There is substantial evidence that depression increases the risk of dementia, and that people living with dementia are at an increased risk of developing depression. However, it's important to note that not everyone with depression will develop dementia, and not everyone with dementia will experience depression. If you feel you may be experiencing depression, speak to your healthcare provider about options to support your well-being and mental health. Depression is a treatable mental health disorder, and seeking treatment for it may reduce your risk of dementia. While depression often responds well to treatment, a traumatic brain injury, often referred to as a TBI, can result in brain damage. Repeated or severe TBIs may increase your dementia risk. A few ways to reduce your risk of a TBI include wearing a helmet or appropriate headgear for activities such as cycling, skateboarding, football, hockey, skiing, snowboarding, and horseback riding. Always wearing your seatbelt, and prioritizing clear walkways in your home by removing tripping hazards. Check out resources and learn more at the Brain Injury Association of North Carolina, BIANC. The next set of risk factors relate to cardiovascular health and include obesity, physical inactivity, high blood pressure, and diabetes. In one large study, obesity contributed to a 30% higher risk of dementia compared to individuals with a lower weight. There's strong evidence that a lack of exercise or physical inactivity also increases dementia risk. Middle-aged and older adults who exercise regularly and maintain a healthy weight experience both improved thinking and memory and a lower risk of developing dementia. A balanced diet and regular exercise are effective strategies towards reducing your risk. While it may feel overwhelming to take on a new exercise routine at any age, here are some tips for getting started. Find an activity you enjoy because this means you're more likely to stick with it. Try wearing a fitness tracker or use a smartphone app to track your daily steps and progress. Look for a walking or hiking group. This is also a way to build and maintain social connections. One of the benefits of exercise is that, along with other strategies, it works to lower your blood pressure. High blood pressure is another risk factor for dementia. Ongoing, untreated high blood pressure can damage the blood vessels in your brain, reducing the amount of oxygen and nutrients reaching your brain cells. Regular checkups and managing your blood pressure through lifestyle changes or medication can make a big difference. In addition to exercise, lifestyle changes include reducing your sodium intake and managing your stress. These can all help to maintain healthy blood pressure. Both type 1 and type 2 diabetes are associated with a higher risk of developing dementia. This is because when diabetes is not controlled, too much sugar remains in the blood. Over time, this can damage organs, including the brain. Your healthcare team can help you manage or prevent diabetes. You can also maintain a balanced diet, exercise regularly to manage blood sugar levels and support brain health, attend regular medical checkups, and take your medication as prescribed. Manage your stress. There are 3 more risk factors that you can do something about: excessive alcohol use, smoking, and air pollution. There is evidence linking excessive alcohol use with an increase in dementia risk. Alcohol is a neurotoxin that can damage brain cells directly. Chronic alcohol use can cause stress and inflammation in the brain and can lead to cardiovascular issues. If you drink alcohol regularly, aim to do so in moderation and within recommended limits. Consider learning about harm reduction strategies, such as opting for drinks with lower alcohol content, or learn about medications that can help reduce cravings or the pleasurable effects of alcohol, such as naltrexone. Or perhaps abstinence is the best strategy for you. There are many different types of support groups and programs to support limiting or abstaining from alcohol. Speak to your healthcare provider to learn more about available resources. Smoking and exposure to secondhand smoke increase the risk of cardiovascular problems, which are linked with two of the most common forms of dementia, Alzheimer's disease and vascular dementia. The most important thing you can do to lower your risk is to quit smoking. In fact, quitting smoking at any age can reduce your risk of dementia and improve your brain health. Studies show quitting smoking reduces the risk to the same level of risk as a non-smoker. Quitting smoking can be difficult. If you smoke and want to quit, some strategies to consider include nicotine replacement therapy, including gum, patches, or lozenges, prescription medicine that reduces cravings and withdrawal symptoms, therapy and support groups, either in person or online, and apps like Quit Guide, Smoke Free, and Quit Now that offer tracking tools, tips, and support. It is worthwhile talking to your doctor about resources that may be available to help you quit. Finally, breathing in a lot of air pollution can make it more likely for someone to develop dementia. This includes tiny particles from car exhaust and wood-burning fireplaces. Often, you will not have control over the outdoor air quality. Instead, focus on elements you can control by checking the air quality before going outside, keeping windows closed and wearing a mask on high pollution days, using an indoor air purifier, avoid smoking, avoid secondhand smoke, and reduce your use of wood fires. Together, these 12 risk factors account for around 40% of dementia cases worldwide. In other words, modifying or preventing these risks might prevent or delay up to 40% of dementias. Understanding and addressing your risk factors can empower you to take proactive steps towards maintaining your cognitive health and enhancing overall well-being. By focusing on things you can control, such as managing health conditions, maintaining a healthy lifestyle, and engaging in regular physical and mental activities, you can reduce the likelihood of developing dementia, improving your quality of life, preserving your independence, and contributing overall to a healthier North Carolina. To learn more about preventing dementia and offering greater support when dementia does occur, consider joining the North Carolina Dementia Friendly Communities and Hospitals Network and the Coalition for Dementia Capable North Carolina. The network and coalition are initiatives of Dementia Capable North Carolina and meet virtually every quarter, which you are welcome to attend. To learn more, visit www.ncdhss.gov/dementiacapablennc. This video was created by CARES at the UNC School of Social Work for the North Carolina Division of Aging.